Hi everybody, I'm Dr. Gavin Scriven. People call me Dr. Gav, and with me is the founder of the non-surgical penis augmentation procedure we call Calibre, Dr. Jayson Oates.
Thanks, Dr. Gav, and together we are the Dick Doctors, and we are going to be talking about all things penis. Our area of expertise is injectable penis augmentation. There's a lot to talk about penises, and together, myself and Dr. Gavin will be doing that. Well, welcome back to the Penis Show. I'm Dr. Jayson, and with me is Dr. Gavin, and together we're the Dick Doctors, and we're here to talk about Calibre and the ideal penis for penis augmentation. How are you, Dr. Gav?
I am very well, thank you, Dr. Jayson. Thanks for having me again, and great to be here to talk about the Calibre procedure. And we've got a good topic today to talk about, really interesting one again, and a question that we get asked all the time. One of my patients today asked me, who's the ideal candidate for this procedure? Am I the right candidate? So is there an ideal candidate for the Calibre procedure? That's our question for today.
Yeah. So I guess to make it really simple for guys, I'll say there are 5 sort of characteristics that I think about when I'm thinking of the ideal penis for Calibre procedure. And that's basically being of normal size, being circumcised, not being too much of a shrinker, maybe having a bigger head than the shaft, and then not being overweight. So those are the 5 things that when I'm looking at a guy, I'm thinking, how good are they as a candidate for the Calibre procedure?
Okay, great. And so that's really interesting. And I'd have to say the same. So let's break it down and go back to those 5 things and talk about why do they matter, those things for the Calibre procedure. So I can't remember what was the first. I think one of the first things was
normal size.
Normal size. Okay.
And I guess you'll find exactly the same as me that the vast majority of the guys that you treat have a normal size penis.
Oh yeah, which is always a shock, I think, to the patient sitting in front of me. I think they expect, for some reason, they're not going around comparing their penis size with any other males. That's probably the first reason why. But they just expect that they're somehow smaller or not average.
Yeah.
And I tend to, objectively look at the penis and measure it. And tell them, no, you are pretty much the average size.
In fact, I'm surprised how many of the guys that I see are just that little bit above average.
Yeah.
When we look at the best studies that were done out of King's College by Professor David Veal, and he looked at 15,000 odd 15,000 men's penises in these studies and looked at what the averages are. Mm-hmm. And in fact, he didn't like the term average. He liked having a graph showing the distribution, but it's too hard to show. But sure. Yeah, most guys have an average size penis.
Yes.
What Calibre isn't for is for a medical condition called micropenis. And a micropenis is when, and the scientific sort of definition is more than 2 standard deviations below the length of an average erect penis, which is about 5.5 inches long, and then usually length is what they're looking at. Basically being less than 7.5 centimeters long erect.
Sure.
Calibre really isn't for those guys. That is the time to see a urologist and look at options for surgical augmentation.
Yeah, and that's obviously quite a rare condition. It's not exactly a common condition. There may be other factors influencing that outcome. So it may not be in isolation, is what I'm trying to say.
Yeah.
So yeah, and that's I can't say I really see, honestly, any people coming with that condition, a micropenis. In fact, thinking back in the last 5 years.
Yeah, I don't think I've seen somebody who really makes that definition of micropenis. So I've seen guys with smaller ones, and I've seen some guys with bigger ones.
Yeah.
But
falling within the normal range, as you say.
Yeah, that sort of bell curve that we did describe, and the vast majority of the guys are in that sort of middle. And I guess the useful thing for guys is if your penis is really on that slightly smaller side, then you don't need actually as many mils of product to make a noticeable difference as a guy who perhaps does have a bigger penis.
Yeah.
So you've got that working in your favor. So size is the first thing. But of course, that's why they're coming in, because they're concerned about the size.
Correct, yes. But I guess what we're just trying to say is there's a condition out there known as the micropenis, or, which is a more of a medical condition that needs to be addressed with other means, but not something that we typically see anyway.
No. So the second thing is being circumcised. And
okay.
And I'm sure you're finding the same as me, that, technically it's somewhat simpler, quicker, easier to augment a circumcised penis than somebody who's got a normal foreskin.
Yes. Yep, I agree. That doesn't mean to say that we can't augment, non-surgically a penis that is uncircumcised. It's still very possible, and still you can end up with a good outcome, a good aesthetic outcome. But yeah, it is a little bit trickier because we are taking into account a plane that's continuous with the foreskin.
Yes. And what you don't want the product sort of ending up in the foreskin. I say to the guys, you don't want to have a cricket ball in a sock sort of effect.
That's a good visual. I need to start using that one myself, but yes. I often I like to draw in my consults, and I draw, an example of a bulging filler in the foreskin. And that's a risk of guys who come in who are uncircumcised, that if the product is to be placed too far distally, it can end up in the foreskin, which often isn't that much of a problem when it's erect. But when it's flaccid, the foreskin can sit just over the penis. And if you're going to the bathroom and you have difficulty retracting the foreskin because there's a lot of filler in the foreskin, you can have trouble passing urine. Aesthetically, when it's flaccid and there's a lot of filler in the foreskin, it may not be as pleasing. It's not a very bad situation from a medical point of view, but aesthetically, it may not be that pleasing.
Yeah. And so, as you're saying, we have ways of putting the product in to try and avoid that as a circumstance. And the other thing is, with a penis that's got a foreskin on it, you can have the flaccid penis with the foreskin sort of over the head, over the glands. And generally, it's pretty easy to get the penis to look good in that condition. The penis is erect and stretches it all out. And generally, it's, with our experience, you can get a penis looking good when it's erect. It's when it's flaccid and they retract the foreskin. So you've got some skin which doesn't really have product in it, and you've got the lower skin which does have product in it. Mm-hmm. That's when it's the hardest to get that looking really good and really natural. But sometimes it's just what you have to accept if you want to have a penis which is an inch bigger in girth.
Correct. Yeah. And, that's right. There are some things you have to accept, and where it's looking good 90% of the time. In very particular situations, it may not look as good. Doesn't cause any problems from a functionality point of view, but just may not be as aesthetically perfect as they, would imagine.
And of course, nowadays, the vast majority of our younger patients are uncircumcised, and the older guys more likely to be circumcised. So now we're dealing with lots of guys who just have their natural foreskin, and that's just part of the job, I guess. And even being circumcised, there are issues with there as well, because in circumcision, there's a scar. And it's not just a scar on the surface, but the scar attaches deeper down and has fibrous sort of bands that go down deep. And that's obviously where we're placing the product. Mm-hmm. And so the circumcision scar can be closer up to the head, to the glands, or it can be lower down. I've seen it all the way down in the middle of the shaft. Mm. And then they've got that very thin skin that sort of between the circumcision scar and the glands. Mm-hmm. And it's much harder to get that nice, smooth, and you just want the product going from that really thick shaft and blending in towards the head. Mm-hmm. And it just takes a little bit more effort. So even with a circumcised penis, there are technical issues that you've got to work with. Mm. And on Monday, I had a guy who came back, and he just had a little bulge on one side past the circumcision scar. Yeah. And he'd had a product, the usual product that we use, which is a hyaluronic acid filler. And I used a medication called Hyalase that obviously you're very familiar with, and 2 little dots of that. And then I spoke to him on Wednesday, smoothed it all out, and it's all fine.
Mm-hmm.
So that is the advantage of using that kind of product.
Yeah. And look, at the end of the day, where it's not a surgical procedure, we can make adjustments because it's not a surgical procedure. There's not much downtime. And I tell all of my clients that, I probably will be doing the procedure over a couple of different treatment sessions for this reason, whether you're circumcised or uncircumcised, so that we can make minor adjustments to get that really nice symmetry that you're after. And that works really nicely. And, funnily enough, I saw a guy who was uncircumcised just last week, and he had one of the best symmetrical outcomes I've seen after one treatment session.
Yeah.
And that's, we happened to hit the perfect plane and do the perfect amount of filler with a nice gradient. And both it was flaccid and erect, and he showed me. And, we'll talk about it in probably some later penis shows about the aftercare and how you can really get that perfect symmetrical outcome with some good techniques. But yeah, so there's even though theoretically a defined space, a circumcised penis is much easier for us, we can still get a good outcome over a couple of different treatment sessions.
Yeah. So that's the second thing. The third thing is having a bigger glans than the shaft. So if the shaft is thinner and then the head of the penis is bigger, sometimes they describe it as being like the mushroom sort of head, like a stalk of a mushroom and the mushroom cap.
Yep.
That's an advantage as well, because you get the best bang for your buck, so to speak, by putting filler into the shaft of the penis. And when you thicken that shaft up and it then matches the bigger glands, that works really well. I'm sure you find the same.
Yeah, I do. Both, it's important. I talk to all of my guys about the aesthetic, approach to that exactly, but also the functional aspect. We're talking penis when it's erect, we're having sex with the penis. The head being a little bit larger makes way, for the rest of the penis. So you don't want a situation where the head is very small, making way for a much larger shaft, and then you're getting stuck a little bit with the shaft, when you're having sex. So it actually matters both aesthetically and functionally.
Yeah. And it is possible, obviously, to put filler into the glands as well.
Yep.
But it just, you don't get that bang for your buck as much. You put 5 mils into a shaft and you're getting this really noticeable difference. And you're putting 5 mils into the glands, which you think is so much smaller. And you think, well, that's going to make this huge difference. And then it only makes a more moderate sort of difference. And that's, I'm sure, to do with the spongy erectile tissue that the glands is made of. And they see it more, I guess, when they're erect than when it's flaccid.
Yeah, that's right. Yeah. I often say it's in the name. The corpus spongiosum, the sponge is in the name. It's a sponge. It takes up a lot of filler and doesn't expand like the shaft does. But as you said, having said that, we can augment the glands, especially around the part that mushrooms up the coronal border. That seems to augment quite nicely, often like the border of the lips in the face. Not your standard comparison that people usually make. But for injector doctors, I'm sure they understand that it's easy to augment that sort of edge, that border, if you like. And then, of course, you get the problem. You put in, say, 15 mils into a guy's penis, and he's got a 1 inch, maybe 3, maybe 4 centimeters increase in circumference, and they love it, and they come back and they want like another 10 mils, and they want the biggest. They want to get 6-inch circumference, 7-inch circumference. And yes, it's doable, and I've done it. But eventually you start getting that shaft, which is much fatter than the head, and it looks like a sausage in a bun, a hot dog sort of thing. And some guys are totally happy with that because they've got the thickest shaft around. But aesthetically, it doesn't look as nice. It doesn't look as natural. Yeah, no, exactly right. It doesn't look as natural. And it's really interesting. how some guys I find are really happy with that massive increase in size. And there are other guys who come back and are worried about the increase in size. They're like, didn't realize how effective it would be. And they're thinking, gosh, I don't like, this is as big as I want it. I don't want it any bigger.
Yeah. Yeah.
So it's really interesting how different all the guys are in their responses.
Yeah. Yeah. Okay. So that's the fourth thing about like the ideal penis for augmentation is shrinkage. And obviously shrinkage is a reason why guys come to see us, because, a guy looks at his penis and it's shrunk up. And they have all kinds of names for it, turtling, but I think shrinkage is the easiest. Some guys are showers. It just hangs out, and it doesn't matter if they're jumping into a freezing cold pool, it just doesn't shrink up. And other people, as soon as the thought that their penis is going to be on show, they're going swimming, so, boom, it just wants to shrink up.
It disappears.
And you'll how many guys have said to you, well, it's normally a lot bigger than this when they're showing it to you for the first time. You say, look, guy,
it's completely
90% of guys, I tell you, as soon as they have to drop their pants and show me, it shrinks up. So too much shrinkage is an issue because it can fold the penis and fold the product in those early few days, an early week or so, when the product is setting in the tissue of the skin. So the straighter the penis is, the less folds and bends in it, the easier it is to keep it straight. And guys who get a lot of shrinkage, that can be more of an issue.
Yeah.
I'm sure you're finding the same sort of thing.
Yeah, definitely. Look, I mean, there's always going to be a certain amount of shrinkage that almost every guy has in different situations. And some guys have worse shrinkage than others. There are ways we can get around it a little bit. I know that you and I both use the same type of medication to actually help relax the penis and help it stay out a little bit more.
Yeah, so that's interesting. I reckon we'll come back and do a specific show just on something like this. But yeah, this idea that there is a medication that makes your penis bigger. It doesn't really make your penis bigger, but it reduces shrinkage a bit. But it's a useful. There's that. Bandaging. There are certain kinds of bandaging that you can use that can help just hold it out a little bit and help prevent shrinkage. And then obviously, and then we'll talk about this, as you say, in aftercare, doing massage and stuff that you can just help make sure that the product is sitting where it needs to be. Yeah. And then you get some guys who've got really severe shrinkage. When they come to show you, and there's like it's like an innie, not an outie, like a belly button sort of thing. Sure. Calibre isn't for those guys, I don't think. No. I've tried it on a guy who's got that literally there's like nothing showing. Sure. And it's just the product is not strong enough to hold it out. Having the weight of the product in most guys' penis actually does help it hold out. The weight of it, that gel not wanting to shrink back in. Yeah, they become somewhat of a shower all of a sudden. Yeah, that's right. You're more of a shower than a grower. Yeah. If you've got hardcore shrinkage, not enough. And that sort of leads us to that final point, which was the, someone with a lot of extra weight, especially just above the penis in the suprapubic area. Yeah, yeah. So being overweight, they say that for 10 kilos, you lose half an inch of penis length. That should be in a lot more of the weight loss products then. That bit of knowledge, I think, would knock off a few more kilos quite fast. I had a guy come and see me, and I said, before we do anything to your penis, you need to lose 30 kilos. There's no point in having a fatter penis under this massive gut. You're just not going to see it. It's not going to do the job. The guy that I saw this morning, actually a really thin guy, and you wouldn't have thought, but just that, what we call that suprapubic fat pad, that fat pad that's really sort of where the pubic hair is, below the belt line, so really low down. When you push that in, his penis grew an inch. And so I was saying to him, look, yes, we can put filler into your penis. We can do an augmentation, but I think before we do that, if we did some liposuction here or using one of the other technologies, freezing it or whatever, if we can get that fat to just come in a little bit, you can see a big difference. And so, yeah, that's sometimes a really useful technique.
Yeah. And just to add to that, Jace, with the guys I see who have that suprapubic fat pad, or the guys who are a little bit more overweight, where the penis does tend to shrink into the fat, I explain to them that, you know, if we do the procedure and the filler, and even if I use something to induce an artificial sort of an erection, such as, you know, a Cavaject, for example, then just after the procedure, when that erection goes down, the penis shrinks back into the fat and pushes the product forward. And I have seen this a few times in the past, having learned, you know, from previous procedures, is that you'll get the bell shape penis, which is not ideal. And that's because the product has been pushed forward by the fat, literally pushed forward. So it's not ideal. Again, there are some workarounds that we can try and you know, work around it, but it's not easy. Yeah.
Well, look, there is never anything wrong with losing weight. You know, makes your penis look bigger. It makes it function better. It makes you more attractive. So everything about, you know, losing weight, getting fitter is better. And if it's about a confidence thing, then you're going to feel more confident if you're thinner than being fat and having a bigger penis.
Yeah, definitely.
That's my take on it.
Yeah, and you know, these are really great points about who's the ideal Calibre candidate, but obviously in real life, and you know as well as I do, we don't see the ideal Calibre candidate walk through the door. So you know, we are able to, and you know, there are different variations and things we're able to work around and usually get a pretty good outcome. But guys just need to be aware of these factors that influence this procedure and you know, the small limitations of the procedure. But I guess with a lot of experience, having injected hundreds, if not thousands of penises, you begin to learn how to take these factors into account, explain to the patient how it will affect the outcome, and what we can do to get a better outcome.
Yeah. And that's what the Penis Show is all about, is to be able to put this information out there, help guys know a bit more about it, because otherwise you never get to, you know, discuss, not seriously either, you know, occasionally, you know, guys be sitting around drinking and have a laugh, but, you know, so rare for guys to be able to talk about this sort of thing.
Well, thanks for listening to us, guys. I'm Dr. Gav, and with me, I've been speaking with Dr. Jayce, the founder of the non-surgical penis augmentation procedure Calibre. And we'll be talking about lots more interesting topics coming up over the next few weeks on a weekly basis, all about penises in the Penis Show. We're the Dick Doctors. Don't forget, confidence changes everything.
Confidence changes everything. Look forward to talking to you guys soon.